My name is Luke Davis, and I'm pleased to be presenting on behalf of the REDI Hub. Yale REDI Hub stands for Rigorous, Rapid, and Relevant Evidence, Adaptation, and Implementation to End the HIV Epidemic. And on behalf of Debbie Humphreys and my colleagues, Christine Brown, Raul Hernandez-Ramirez, and Nikita Rao, as well as Ellie Zelazny, who's our center coordinator, and an illustrious collection of co-investigators and community members, I'm pleased to tell you a little bit about our hub. We are based at the Yale School of Public Health, and we benefit from partnerships with the Yale Center for Interdisciplinary Research on AIDS, which is an NIMH P30 funded AIDS research center with a strong focus on HIV implementation science in the New England region, as well as the Yale Center for Methods and Implementation and Prevention Sciences, or CMIPS, which is our implementation science center, which has a strong focus on developing methods, both quantitative methods and qualitative methods. Over the last few years, a growing amount of evidence in the field of implementation science has demonstrated that the community-engaged approaches are much more powerful in implementing evidence-based practices than practices that are coming from investigators alone, for example. And that's going to be the focus of my talk today. So in order to conduct this research, we started by reviewing the literature to try to understand what types of research are being done in the field of community-engaged research. We did a systematic review and identified over 370 articles that mentioned community engagement in some way. And the goal of this was really to understand the depth of engagement. When we think about community engagement, that's a broad term that can mean many different things. And if you look at the graph on the right side of the slide, you can see that we've described these different stages of implementation from at the left, kind of the least amount of engagement with the community. And at the right side of the slide, you can see the most amount of engagement with the community. And the proportion of studies is represented. And first of all, a large proportion of these studies, over a third of them, even though they mentioned community engagement as a major focus of their study, didn't give them methods to describe how they used community-engaged research. And then among the other studies, only about half of them used what we'd call highly engaged approaches, such as community-based participatory research or community-led research. And there really wasn't much of a difference either before the HE or after the HE. So in thinking about this, we wanted to figure out how could we work with the community and what parts of the community that we want to engage. And so we took advantage of a framework called the 7 Ps framework developed by Concannon and colleagues, which layers on the social ecological model some thoughts about who those stakeholders are. And we know that with traditional efficacy or effectiveness research, there's a large amount of engagement with the people at the outermost levels, the policymakers, the purchasers and the payers, and the folks who are making the drugs, devices, and tests that are very important for advancing HIV innovations. And principal investigators kind of sit at the middle, but as we think about implementation research, there's really a need to look inward and approach those people at the front lines, such as providers and implementing partners, as well as, of course, participants in the public. Who really have the opportunity to take these things forward. And so we're developing 3 types of resources, technical resources, in order to do this. The first is a community-based participatory research training for researchers. We're doing that in partnership with community partners. It's a 6-hour approach to kind of teach implementation researchers how to approach the community, what principles are important, and most importantly, what are some practical ways of building strong and lasting partnerships. Second, we're going to be convening what we call a community of practice for implementing partners. And the goal there is really to take advantage of the tacit knowledge that implementing partners have from working in communities over the years and surface some of these strategies that are very effective, because we know that partners can learn from each other if we create the environment for them to do so. And then finally, a very important part of this is to not just learn, but also to disseminate, to spread across the country to these 57 EHE regions. And in that regard, we're testing and refining community-facing dissemination templates, such as what you see there on the right, which incorporate infographics and communicate in ways that are easily understood what these efforts are. Overall goal here is to strengthen partnerships and build better relationships for implementation science research. Thank you.